1. Tuberculosis is caused by a gram-negative bacterium known as Mycobacterium tuberculosis. True or false? Answer: false rationale. Mycobacterium tuberculosis is an acid-fast bacillus, not a gram-negative bacterium. Its unique waxy cell wall, rich in mycolic acids, resists standard gram staining, requiring acid-fast staining for identification, per CDC guidelines. 2. Tuberculosis is primarily transmitted through airborne droplets. True or false? Answer: true rationale. TB is spread via airborne droplets when an infected person coughs, sneezes, or speaks, allowing Mycobacterium tuberculosis to be inhaled by others, per WHO transmission protocols. 3. Latent TB infection can progress to active TB disease in all cases. True or false? Answer: false rationale. Only about 5 to 10% of individuals with latent TB infection, LTBI, develop active TB disease, often due to immunosuppression or other risk factors, per CDC epidemiology data. 4. A positive tuberculin skin test, TST, always indicates active TB disease. True or false? Answer: false rationale. A positive TST indicates TB infection but does not distinguish between latent TB and active disease. Further evaluation, like chest X-rays and sputum analysis, is needed, per CDC Diagnostic guidelines. 5. Night sweats are a common symptom of active pulmonary TB. True or false? Answer: true rationale. Night sweats, along with fever, cough, and weight loss, are hallmark symptoms of active pulmonary TB due to the systemic inflammatory response, per American Thoracic Society clinical manifestations. 6. Isoniazid is a first-line drug used to treat active TB. True or false? Answer: true rationale. Isoniazid is a key first-line drug in TB treatment, used in combination with rifampin, pyrazinamide, and ethambutol for active TB, per WHO treatment regimens. 7. Multi-drug-resistant TB, MDR-TB, is resistant to isoniazid and rifampin. True or false? Answer: true rationale. MDR-TB is defined as resistance to at least isoniazid and rifampin, the two most effective first-line drugs, requiring second-line treatment, per CDC definitions. 8. Patients with active pulmonary TB should be placed in droplet isolation. True or false? Answer: false rationale. Active pulmonary TB requires airborne isolation, not droplet isolation, due to the transmission via small airborne particles, per CDC infection control guidelines. 9. The BCG vaccine provides complete protection against TB infection. True or false? Answer: false rationale. The BCG vaccine reduces the risk of severe TB forms, e.g., miliary TB, in children but does not fully prevent TB infection or pulmonary TB in adults, per WHO vaccination data. 10. A chest X-ray showing a cavitary lesion is suggestive of active TB. True or false? Answer: true rationale. Cavitary lesions on chest X-rays are characteristic of advanced active pulmonary TB, indicating tissue destruction by Mycobacterium tuberculosis, per radiologic findings. 11. TB can only affect the lungs. True or false? Answer: false rationale. TB can affect extrapulmonary sites, such as lymph nodes, bones, kidneys, and meninges, especially in immunocompromised patients, per CDC clinical presentations. 12. The QuantiFERON TB Gold test is an interferon gamma release assay used to diagnose TB infection. True or false? Answer: true rationale. The QuantiFERON TB Gold test measures interferon gamma release in response to TB antigens, aiding in diagnosing latent or active TB infection, per CDC Diagnostic protocols. 13. Patients with latent TB infection are contagious. True or false? Answer: false rationale. Latent TB infection is not contagious, as the bacteria are dormant and not actively replicating in the lungs, per WHO transmission principles. 14. Rifampin can cause orange discoloration of body fluids. True or false? Answer: true rationale. Rifampin, a first-line TB drug, commonly causes harmless orange discoloration of urine, sweat, and tears, requiring patient education, per pharmacological side effects. 15. TB treatment typically lasts 3 months for active disease. True or false? Answer: false rationale. Active TB treatment usually requires 6 to 9 months of multi-drug therapy, including an intensive phase, 2 months, and continuation phase, 4 to 7 months, per WHO guidelines. 16. HIV-positive patients are at higher risk for developing active TB. True or false? Answer: true rationale. HIV weakens the immune system, increasing the risk of latent TB progressing to active disease, with a 20 to 30 times higher risk per CDC epidemiology. 17. The nurse should wear an N95 respirator when caring for a patient with active pulmonary TB. True or false? Answer: true rationale. An N95 respirator is required for airborne precautions to protect against inhaling Mycobacterium tuberculosis, per CDC infection control standards. 18. A negative sputum culture definitively rules out active TB. True or false? Answer: false rationale. A negative sputum culture does not rule out active TB, as early or extrapulmonary TB may not yield positive cultures. Clinical correlation is needed, per diagnostic protocols. 19. Ethambutol can cause optic neuritis as a side effect. True or false? Answer: true rationale. Ethambutol, a first-line TB drug, can cause optic neuritis, leading to vision changes, requiring baseline and periodic vision assessments, per pharmacological monitoring. 20. TB screening is recommended for healthcare workers due to occupational exposure risk. True or false? Answer: true rationale. Healthcare workers are at increased risk for TB exposure, necessitating regular screening, e.g., TST or IGRA, to detect infection early, per CDC occupational health guidelines. 21. Patients with active TB can return to work after 1 week of treatment. True or false? Answer: false rationale. Patients with active TB typically require at least 2 to 3 weeks of treatment and negative sputum smears before being considered non-infectious, per CDC return-to-work criteria. 22. The tuberculin skin test measures induration, not erythema, to determine a positive result. True or false? Answer: true rationale. The TST result is based on the size of induration, raised area, not erythema, redness, measured in millimeters, per CDC diagnostic criteria. 23. Isoniazid monotherapy is used to treat active pulmonary TB. True or false? Answer: false rationale. Active TB requires a multi-drug regimen, e.g., isoniazid, rifampin, pyrazinamide, ethambutol, to prevent resistance. Isoniazid monotherapy is used for latent TB, per WHO guidelines. 24. TB can be transmitted through contaminated food or water. True or false? Answer: false rationale. TB is primarily transmitted through airborne droplets, not food or water, except in rare cases of bovine TB from unpasteurized milk, per CDC transmission data. 25. Hemoptysis is a symptom of advanced pulmonary TB. True or false? Answer: true rationale. Hemoptysis, coughing up blood, occurs in advanced pulmonary TB due to lung tissue damage and cavitation, per American Thoracic Society clinical manifestations. 26. Directly observed therapy, DOT, is recommended for TB treatment to ensure adherence. True or false? Answer: true rationale. DOT, where healthcare providers observe medication intake, improves adherence and reduces resistance risk in TB treatment, per WHO recommendations. 27. A positive interferon gamma release assay, IGRA, confirms active TB disease. True or false? Answer: false rationale. A positive IGRA indicates TB infection but cannot differentiate between latent and active TB. Further tests like chest X-rays are needed, per CDC Diagnostics. 28. Pyrazinamide is used only during the continuation phase of TB treatment. True or false? Answer: false rationale. Pyrazinamide is used during the 2-month intensive phase of active TB treatment, not the continuation phase, due to its bactericidal activity, per WHO regimens. 29. TB infection can remain latent for years without symptoms. True or false? Answer: true rationale. Latent TB infection can persist for years or decades without symptoms, with bacteria dormant in the body, per CDC Pathophysiology. 30. Patients with NCLEX-RN require shorter treatment durations than those with drug-susceptible TB. True or false? Answer: false rationale. NCLEX-TB treatment lasts 18 to 24 months with second-line drugs, longer than the 6 to 9 months for drug-susceptible TB, due to resistance, per WHO guidelines. 31. The nurse should teach TB patients to cover their mouth when coughing. True or false? Answer: true rationale. Covering the mouth when coughing reduces airborne transmission of Mycobacterium tuberculosis, a key patient education point, per CDC infection control. 32. A chest X-ray is the only diagnostic tool needed to confirm active TB. True or false? Answer: false rationale. A chest X-ray supports TB diagnosis, but requires confirmation with sputum culture or molecular tests, e.g., GeneXpert, for definitive diagnosis, per CDC protocols. 33. Rifampin requires monitoring for hepatotoxicity. True or false? Answer: true rationale. Rifampin can cause hepatotoxicity, necessitating regular liver function tests during TB treatment, per pharmacological monitoring guidelines. 34. TB is more common in urban areas than rural areas. True or false? Answer: true rationale. TB prevalence is higher in urban areas due to crowding, poor ventilation, and higher population density, per WHO epidemiology data. 35. The BCG vaccine is routinely administered in the United States. True or false? Answer: false rationale. The BCG vaccine is not routinely used in the U.S. due to low TB prevalence and variable efficacy. It is more common in high-burden countries, per CDC vaccination policy. 36. Patients with active TB should avoid contact with infants. True or false? Answer: true rationale. Infants are at high risk for severe TB forms, e.g., miliary TB, necessitating avoidance of contact with active TB patients until non-infectious, per CDC guidelines. 37. Isoniazid can cause peripheral neuropathy as a side effect. True or false? Answer: true rationale. Isoniazid depletes vitamin B6, potentially causing peripheral neuropathy. Pyridoxine supplementation is recommended, per pharmacological side effects. 38. All TB patients require hospitalization during treatment. True or false? Answer: false rationale. Most TB patients can be treated outpatient with DOT unless they have severe disease, complications, or adherence issues, per CDC treatment protocols. 39. Contact tracing is a public health strategy for TB control. True or false? Answer: true rationale. Contact tracing identifies and screens individuals exposed to TB, enabling early detection and treatment to prevent spread, per WHO public health strategies. 40. A 5 mm in duration on a TST is considered positive in all populations. True or false? Answer: false rationale. TST induration thresholds vary. 5 mm is positive in high-risk groups, e.g., HIV positive, 10 mm in moderate risk, and 15 mm in low risk, per CDC criteria. 41. TB can cause pleural effusion in extrapulmonary disease. True or false? Answer: true rationale. Pleural effusion is a common presentation of extrapulmonary TB, resulting from pleural infection by Mycobacterium tuberculosis, per clinical manifestations. 42. Second-line TB drugs are more effective than first-line drugs. True or false? Answer: false rationale. Second-line drugs, e.g., fluoroquinolones, are less effective and more toxic than first-line drugs, used only for resistant TB, per WHO treatment guidelines. 43. The nurse should monitor for hearing loss in patients taking streptomycin. True or false? Answer: true rationale. Streptomycin, a second-line TB drug, can cause ototoxicity, leading to hearing loss, requiring auditory monitoring per pharmacological side effects. 44. TB transmission is more likely in well-ventilated areas. True or false? Answer: false rationale. TB transmission is more likely in poorly ventilated, crowded areas, as airborne droplets linger longer, per CDC transmission risk factors. 45. Patients with latent TB should receive a 6 to 9 month course of isoniazid. True or false? Answer. True. Rationale. A 6 to 9 month course of isoniazid is a standard treatment for latent TB to prevent progression to active disease, per CDC treatment guidelines. 46. Active TB always presents with a productive cough. True or false? Answer. False. Rationale. Active TB may present with a non-productive cough, systemic symptoms, or extrapulmonary manifestations, not always productive cough, per clinical variability. 47. The GeneXpert MTB/REF test can detect rifampin resistance. True or false? Answer. True. Rationale. The GeneXpert MTB/REF test is a molecular assay that detects Mycobacterium tuberculosis and rifampin resistance, aiding rapid NDR-TB diagnosis, per WHO Diagnostics. 48. TB treatment can be safely stopped if symptoms resolve after 1 month. True or false? Answer. False. Rationale. TB treatment must continue for the full 6 to 9 months, even if symptoms resolve, to ensure complete bacterial eradication and prevent relapse, per WHO guidelines. 49. Diabetes mellitus increases the risk of developing active TB. True or false? Answer. True. Rationale. Diabetes impairs immune function, increasing the risk of latent TB progressing to active disease, per CDC risk factor data. 50. A negative TST rules out TB infection in immunocompromised patients. True or false? Answer. False. Rationale. Immunocompromised patients may have false negative TST results due to weakened immune responses, requiring additional tests like IgRA, per CDC Diagnostics. 51. The nurse should teach TB patients to take medications on an empty stomach. True or false? Answer. True. Rationale. Many TB drugs, like isoniazid and rifampin, are better absorbed on an empty stomach to maximize efficacy, per Pharmacological administration guidelines. 52. TB is a reportable disease to public health authorities. True or false? Answer. True. Rationale. TB is a reportable disease to enable contact tracing, surveillance, and outbreak control, per CDC public health mandates. 53. Extrapulmonary TB is more common in immunocompetent individuals. True or false? Answer. False. Rationale. Extrapulmonary TB is more common in immunocompromised individuals, such as those with HIV, due to impaired immune control, per CDC epidemiology. 54. The BCG vaccine increases the risk of a positive TST result. True or false? Answer. True. Rationale. The BCG vaccine can cause a false positive TST result, especially in recently vaccinated individuals, necessitating IgRA use, per CDC diagnostic considerations. 55. Active TB patients should avoid sharing utensils to prevent transmission. True or false? Answer. False. Rationale. TB is not transmitted through sharing utensils, as it spreads via airborne droplets, not fomites, per CDC transmission routes. 56. Pyrazinamide can cause hyperuricemia as a side effect. True or false? Answer. True. Rationale. Pyrazinamide inhibits uric acid excretion, potentially causing hyperuricemia and gout, requiring monitoring, per pharmacological side effects. 57. TB can cause miliary TB, a disseminated form of the disease. True or false? Answer. True. Rationale. Miliary TB is a severe, disseminated form of TB with widespread organ involvement, often seen in immunocompromised patients, per clinical manifestations. 58. All patients with active TB require surgical intervention. True or false? Answer. False. Rationale. Most active TB cases are managed with multi-drug therapy. Surgery is rare, reserved for complications like abscesses, per WHO treatment protocols. 59. The nurse should assess for weight loss in patients suspected of TB. True or false? Answer. True. Rationale. Unexplained weight loss is a common symptom of active TB due to systemic inflammation and increased metabolic demand, per clinical assessment guidelines. 60. TB treatment regimens are the same for children and adults. True or false? Answer. False rationale. Pediatric TB treatment regimens may differ in drug dosing and duration, adjusted for weight and age, per WHO pediatric guidelines. 61. A sputum smear positive for acid-fast bacilli confirms TB diagnosis. True or false? Answer. False rationale. A positive sputum smear suggests TB but requires culture or molecular confirmation, as other mycobacteria can be acid-fast, per CDC Diagnostics. 62. Patients with active TB should receive the BCG vaccine. True or false? Answer. False rationale. The BCG vaccine is contraindicated in active TB, as it is a live vaccine and ineffective in treating active disease, per WHO vaccination guidelines. 63. TB can cause lymphadenitis in extrapulmonary disease. True or false? Answer. True rationale. TB lymphadenitis, often affecting cervical lymph nodes, is a common form of extrapulmonary TB, per clinical manifestations. 64. Rifampin is safe for use in patients with severe liver disease. True or false? Answer. False rationale. Rifampin is hepatotoxic and contraindicated or used cautiously in severe liver disease, requiring alternative regimens, per pharmacological precautions. 65. The nurse should teach TB patients to avoid alcohol during treatment. True or false? Answer. True rationale. Alcohol increases the risk of hepatotoxicity from TB drugs like isoniazid and rifampin, necessitating avoidance, per patient education guidelines. 66. TB is less contagious in patients with extrapulmonary disease. True or false? Answer. True rationale. Extrapulmonary TB is generally less contagious than pulmonary TB, as it does not involve active lung bacterial shedding, per CDC transmission principles. 67. The T-spot TB test is a type of interferon gamma release assay. True or false? Answer. True rationale. The T-spot TB test is an IGRA that detects TB infection by measuring T-cell response to TB antigens, per CDC Diagnostic tools. 68. Latent TB treatment is mandatory for all diagnosed individuals. True or false? Answer. False rationale. Latent TB treatment is recommended but not mandatory, depending on risk factors, e.g., immunosuppression, per CDC treatment guidelines. 69. TB can cause vertebral osteomyelitis, known as Pott's disease. True or false? Answer. True rationale. Pott's disease is TB of the spine, causing vertebral osteomyelitis and potential deformity, a form of extrapulmonary TB, per clinical manifestations. 70. Patients with active TB should wear surgical masks in public. True or false? Answer. True rationale. Surgical masks on active TB patients reduce droplet spread in public settings until they are non-infectious, per CDC infection control. 71. Isoniazid is used to treat MDR-TB. True or false? Answer. False rationale. MDR-TB is resistant to isoniazid, requiring second-line drugs like fluoroquinolones or bedaquiline, per WHO MDR-TB treatment guidelines. 72. TB screening is recommended for recent immigrants from high-burden countries. True or false? Answer. True rationale. Recent immigrants from high TB burden countries are at increased risk, necessitating screening with TST or IGRA, per CDC public health protocols. 73. A chest X-ray showing hilar lymphadenopathy is suggestive of TB. True or false? Answer. True rationale. Hilar lymphadenopathy on chest X-ray is a common finding in primary TB, especially in children, per radiologic findings. 74. TB treatment can cause photosensitivity as a side effect. True or false? Answer. True rationale. Rifampin can cause photosensitivity, increasing sunburn risk, requiring patient education on sun protection, per pharmacological side effects. 75. Active TB can be diagnosed solely based on clinical symptoms. True or false? Answer. False rationale. Clinical symptoms alone are insufficient for TB diagnosis, requiring microbiologic or radiologic confirmation, per CDC diagnostic standards. 76. The nurse should monitor for gastrointestinal upset in patients taking rifampin. True or false? Answer: true rationale. Rifampin can cause nausea and abdominal pain, requiring monitoring and patient education on taking it with food if needed, per pharmacological side effects. 77. TB can cause meningitis in immunocompromised patients. True or false? Answer: true rationale. TB meningitis is a severe extrapulmonary form, more common in immunocompromised patients, with high morbidity, per clinical manifestations. 78. All TB patients require a 12-month treatment regimen. True or false? Answer: false rationale. Standard active TB treatment lasts 6 to 9 months. Longer regimens, e.g., 12 to 24 months, are for MDR-TB or complications, per WHO guidelines. 79. The nurse should teach TB patients to report yellowing of the skin. True or false? Answer: true rationale. Yellowing of the skin, jaundice, may indicate hepatotoxicity from TB drugs like isoniazid or rifampin, requiring immediate reporting, per patient education. 80. TB is more prevalent in low-income populations. True or false? Answer: true rationale. Low-income populations face higher TB risk due to poor living conditions, malnutrition, and limited healthcare access, per WHO epidemiology. 81. A positive sputum culture is required for TB treatment initiation. True or false? Answer: false rationale. TB treatment can be initiated based on clinical and radiologic suspicion, pending culture results, to prevent delays, per CDC treatment protocols. 82. The BCG vaccine is effective against multi-drug-resistant TB. True or false? Answer: false rationale. The BCG vaccine has limited efficacy against pulmonary TB and no specific protection against MDR-TB, per WHO vaccination data. 83. TB can cause fatigue as a systemic symptom. True or false? Answer: true rationale. Fatigue is a common systemic symptom of active TB due to chronic inflammation and metabolic demands, per clinical manifestations. 84. Patients with active TB can safely breastfeed without precautions. True or false? Answer: false rationale. Active TB patients can breastfeed if on treatment and non-infectious, but precautions, e.g., masks, are needed initially, per CDC guidelines. 85. The nurse should assess for chest pain in TB patients. True or false? Answer: true rationale. Chest pain may occur in pulmonary TB due to pleural involvement or lung inflammation, requiring assessment, per clinical evaluation guidelines. 86. TB treatment is ineffective in HIV-positive patients. True or false? Answer: false rationale. TB treatment is effective in HIV-positive patients, though it may require adjusted regimens and concurrent antiretroviral therapy, per WHO co-infection guidelines. 87. A negative IgRA test rules out TB infection in all patients. True or false? Answer: false rationale. A negative IgRA may be false in immunocompromised or early infection patients, requiring clinical correlation, per CDC Diagnostics. 88. TB can cause renal involvement in extrapulmonary disease. True or false? Answer: true rationale. Renal TB is a form of extrapulmonary disease, causing symptoms like hematuria or sterile pyuria, per clinical manifestations. 89. Patients with latent TB require airborne precautions. True or false? Answer: false rationale. Latent TB is not contagious, so airborne precautions are not needed, unlike active pulmonary TB, per CDC infection control. 90. Ethambutol is safe for use in patients with pre-existing vision problems. True or false? Answer: false rationale. Ethambutol can cause optic neuritis, worsening vision problems, and is used cautiously with baseline vision testing, per pharmacological precautions. 91. TB can be transmitted during brief, casual contact. True or false? Answer: false rationale. TB transmission typically requires prolonged, close contact in enclosed spaces, not brief or casual contact, per CDC transmission risk. 92. The nurse should teach TB patients to complete the full course of treatment. True or false? Answer: true rationale. Completing the full treatment course prevents relapse and drug resistance, a critical patient education point, per WHO adherence guidelines. 93. TB can cause a gone focus on chest X-ray in primary infection. True or false? Answer. True rationale. A gone focus, a calcified lung lesion, is a radiologic sign of primary TB infection, often seen in children, per radiologic findings. 94. All TB patients experience fever as a symptom. True or false? Answer. False rationale. Fever is common in active TB but not universal, especially in early or extrapulmonary cases, per clinical variability. 95. The nurse should monitor for renal toxicity in patients taking rifampin. True or false? Answer. False rationale. Rifampin primarily causes hepatotoxicity, not renal toxicity. Renal function is monitored with drugs like streptomycin, per pharmacological monitoring. 96. TB is a leading cause of death in HIV-positive individuals. True or false? Answer. True rationale. TB is a major cause of mortality in HIV-positive individuals due to their increased susceptibility to active disease, per WHO epidemiology. 97. A positive TST in a BCG-vaccinated individual always indicates TB infection. True or false? Answer. False rationale. A positive TST in BCG-vaccinated individuals may be a false positive. IgRA tests are preferred for accuracy, per CDC Diagnostics. 98. TB treatment includes a combination of at least 4 drugs in the intensive phase. True or false? Answer. True rationale. The intensive phase of active TB treatment typically includes 4 drugs, isoniazid, rifampin, pyrazinamide, ethambutol, to ensure efficacy, per WHO regimens. 99. The nurse should assess for dyspnea in patients with pulmonary TB. True or false? Answer. True rationale. Dyspnea may occur in pulmonary TB due to lung tissue damage or pleural effusion, requiring assessment, per clinical evaluation guidelines. 100. TB can be cured with a single antibiotic. True or false? Answer. False rationale. TB requires a multi-drug regimen to prevent resistance and ensure cure. Single-drug therapy is ineffective, per WHO treatment principles. 101. Mycobacterium tuberculosis can survive in the environment for weeks. True or false? Answer. True rationale. Mycobacterium tuberculosis can survive in dry droplet nuclei for weeks, especially in dark, poorly ventilated areas, increasing transmission risk, per CDC environmental persistence data. 102. A positive chest X-ray always confirms active TB disease. True or false? Answer. False rationale. A positive chest X-ray, e.g., infiltrates cavitation, suggests TB but requires microbiologic confirmation, e.g., sputum culture, to diagnose active disease, per CDC Diagnostic standards. 103. Patients with active TB should be educated to avoid crowded places. True or false? Answer. True rationale. Avoiding crowded places reduces the risk of TB transmission through airborne droplets, a key patient education point, per WHO infection control guidelines. 104. The BCG vaccine is recommended for adults in high TB burden countries. True or false? Answer. False rationale. The BCG vaccine is primarily used in children in high-burden countries, not adults, due to limited efficacy against pulmonary TB, per WHO vaccination policy. 105. Fatigue is a common symptom of latent TB infection. True or false? Answer. False rationale. Latent TB infection is asymptomatic. Fatigue is a symptom of active TB due to systemic inflammation, per CDC clinical manifestations. 106. Isoniazid and rifampin are used together in the continuation phase of TB treatment. True or false? Answer. True rationale. The continuation phase of TB treatment, 4 to 7 months, typically includes isoniazid and rifampin to eradicate remaining bacteria, per WHO treatment regimens. 107. Multi-drug-resistant TB can be treated with first-line drugs. True or false? Answer. False rationale. NDR-TB is resistant to first-line drugs, isoniazid, rifampin, requiring second-line drugs like fluoroquinolones or injectable agents, per WHO NDR-TB guidelines. 108. The nurse should use standard precautions for patients with latent TB. True or false? Answer: true. Rationale: latent TB is not contagious, requiring only standard precautions, unlike active pulmonary TB, which needs airborne precautions per CDC infection control. 109. A sputum culture is the gold standard for confirming active TB. True or false? Answer: true. Rationale: sputum culture is the gold standard for confirming active TB, identifying Mycobacterium tuberculosis with high specificity per CDC diagnostic protocols. 110. TB can be transmitted through blood transfusion. True or false? Answer: false. Rationale: TB is primarily transmitted through airborne droplets, not blood transfusion, as Mycobacterium tuberculosis does not typically circulate in blood per CDC transmission routes. 111. Patients with active TB should have regular follow-up sputum tests. True or false? Answer: true. Rationale: regular sputum tests monitor treatment response and infectiousness in active TB patients, typically monthly until negative, per WHO monitoring guidelines. 112. The tuberculin skin test is reliable in infants under 6 months. True or false? Answer: false. Rationale: the TST is less reliable in infants under 6 months due to immature immune responses, often yielding false negatives per CDC diagnostic limitations. 113. Rifampin can interact with oral contraceptives, reducing their effectiveness. True or false? Answer: true. Rationale: rifampin induces liver enzymes, accelerating metabolism of oral contraceptives, requiring alternative contraception per pharmacological interactions. 114. All patients with TB require lifelong treatment. True or false? Answer: false. Rationale: most TB cases are cured with 6 to 9 months of treatment. Only complex cases, e.g. MDR-TB, may require longer durations per WHO treatment protocols. 115. TB can cause pericarditis in extrapulmonary disease. True or false? Answer: true. Rationale: TB pericarditis is a form of extrapulmonary TB, causing pericardial inflammation and potential effusion per clinical manifestations. 116. The nurse should wear a surgical mask when caring for a TB patient. True or false? Answer: false. Rationale: an N95 respirator, not a surgical mask, is required for airborne precautions to protect against Mycobacterium tuberculosis per CDC infection control standards. 117. The quantiferin TB gold test is less affected by BCG vaccination than the TST. True or false? Answer: true. Rationale: the quantiferin TB gold test, an IGRA, is more specific and less likely to yield false positives in BCG-vaccinated individuals per CDC diagnostic advantages. 118. Active TB can be asymptomatic in early stages. True or false? Answer: true. Rationale: early active TB may be asymptomatic or present with nonspecific symptoms, especially in immunocompromised patients, per clinical variability. 119. Pyrazinamide is contraindicated in patients with gout. True or false? Answer: true. Rationale: pyrazinamide increases uric acid levels, exacerbating gout, and is used cautiously or avoided in these patients, per pharmacological precautions. 120. TB screening is unnecessary for low-risk populations. True or false? Answer: true. Rationale: low-risk populations, e.g., no exposure or comorbidities, do not require routine TB screening per CDC risk-based screening guidelines. 121. The nurse should assess for night sweats in suspected TB cases. True or false? Answer: true. Rationale: night sweats are a hallmark symptom of active TB, reflecting systemic inflammation, and should be assessed per clinical evaluation guidelines. 122. The BCG vaccine prevents latent TB infection. True or false? Answer: false. Rationale: the BCG vaccine reduces severe TB forms in children but does not prevent latent TB infection, per WHO vaccination efficacy data. 123. Patients with active TB should be isolated in a negative pressure room. True or false? Answer: true. Rationale: negative pressure rooms prevent airborne spread of Mycobacterium tuberculosis, a standard for active pulmonary TB, per CDC infection control. 124. A single negative sputum smear rules out active TB. True or false? Answer. False rationale. A single negative sputum smear does not rule out active TB, as multiple samples or cultures are needed for accuracy, per CDC Diagnostics. 125. Ethambutol is used in the treatment of latent TB. True or false? Answer. False rationale. Ethambutol is used for active TB, not latent TB, which is typically treated with isoniazid or rifampin monotherapy, per WHO treatment guidelines. 126. TB can cause infertility in women due to genital TB. True or false? Answer. True rationale. Genital TB, an extrapulmonary form, can affect the fallopian tubes or uterus, leading to infertility, per clinical manifestations. 127. The nurse should teach TB patients to report vision changes while on ethambutol. True or false? Answer. True rationale. Ethambutol can cause optic neuritis, leading to vision changes, requiring immediate reporting for evaluation, per patient education guidelines. 128. TB is only contagious when symptoms are present. True or false? Answer. False rationale. Active pulmonary TB can be contagious before symptoms are evident, especially in early stages, per CDC transmission principles. 129. The GeneXpert MTB/REF test provides results within hours. True or false? Answer. True rationale. The GeneXpert MTB/REF test is a rapid molecular assay, delivering TB and rifampin resistance results within 2 hours, per WHO Diagnostic tools. 130. Patients with active TB can safely travel by airplane after 1 week of treatment. True or false? Answer. False rationale. Active TB patients should not travel by airplane until non-infectious, e.g., after 2 to 3 weeks of treatment and negative sputum, per CDC travel guidelines. 131. Malnutrition increases the risk of TB progression. True or false? Answer. True rationale. Malnutrition weakens the immune system, increasing the risk of latent TB progressing to active disease, per WHO risk factors. 132. The TST is the most accurate test for diagnosing active TB. True or false? Answer. False rationale. The TST detects TB infection but is not specific for active TB. Sputum culture or molecular tests are needed for diagnosis, per CDC Diagnostics. 133. Patients with TB should be monitored for drug-induced hepatitis. True or false? Answer. True rationale. TB drugs like isoniazid and rifampin can cause drug-induced hepatitis, requiring regular liver function tests, per pharmacological monitoring. 134. TB can be transmitted through casual handshakes. True or false? Answer. False rationale. TB is not transmitted through casual contact like handshakes, as it requires inhalation of airborne droplets, per CDC transmission routes. 135. A 10 mm induration on a TST is positive in healthcare workers. True or false? Answer. True rationale. A 10 mm induration is considered positive in healthcare workers due to occupational exposure risk, per CDC TST interpretation criteria. 136. All forms of TB are curable with standard treatment. True or false? Answer. False rationale. While drug-susceptible TB is curable, extensively drug-resistant TB, XDR-TB, has lower cure rates due to limited treatment options, per WHO data. 137. The nurse should teach TB patients to take medications at the same time daily. True or false? Answer. True rationale. Consistent daily timing of TB medications ensures steady drug levels, improving efficacy and adherence, per patient education guidelines. 138. TB can cause a normal chest X-ray in early active disease. True or false? Answer. True rationale. Early active TB may show a normal chest X-ray, especially in immunocompromised patients, requiring further testing, per radiologic findings. 139. Streptomycin is a first-line drug for TB treatment. True or false? Answer. False rationale. Streptomycin is a second-line drug, used for resistant TB, while first-line drugs include isoniazid, rifampin, pyrazinamide, and ethambutol, per WHO regimens. 140. TB can cause adrenal insufficiency in extrapulmonary disease. True or false? Answer. True rationale. TB can affect the adrenal glands, causing adrenal insufficiency, Addison's disease, a rare extrapulmonary manifestation, per clinical manifestations. 141. The nurse should assess for cough duration in suspected TB cases. True or false? Answer. True rationale. A cough lasting more than 2 to 3 weeks is a key symptom of pulmonary TB, requiring assessment, per clinical evaluation guidelines. 142. The BCG vaccine is effective against extrapulmonary TB in adults. True or false? Answer. False rationale. The BCG vaccine has limited efficacy against extrapulmonary TB in adults, primarily reducing severe forms in children, per WHO vaccination data. 143. Patients with active TB should have their sputum tested for drug susceptibility. True or false? Answer. True rationale. Drug susceptibility testing of sputum identifies resistance patterns, guiding treatment for drug-susceptible or resistant TB, per WHO Diagnostic protocols. 144. A positive IGRA test indicates a recent TB infection. True or false? Answer. False rationale. A positive IGRA indicates TB infection but cannot determine whether it is recent or past, requiring clinical correlation, per CDC Diagnostics. 145. Rifampin can cause red-orange urine as a side effect. True or false? Answer. True rationale. Rifampin causes harmless red-orange discoloration of urine and other body fluids, a common side effect requiring patient education, per pharmacological effects. 146. TB treatment can be completed in 2 months for active disease. True or false? Answer. False rationale. Active TB treatment requires 6 to 9 months, including a 2-month intensive phase and a 4-7-month continuation phase, per WHO guidelines. 147. Smoking increases the risk of developing active TB. True or false? Answer. True rationale. Smoking damages lung tissue and impairs immunity, increasing the risk of latent TB progressing to active disease, per WHO risk factors. 148. The nurse should use droplet precautions for active TB patients. True or false? Answer. False rationale. Active pulmonary TB requires airborne precautions, not droplet precautions, due to transmission via small airborne particles, per CDC infection control. 149. TB can cause weight gain as a symptom. True or false? Answer. False rationale. Active TB typically causes weight loss due to increased metabolic demand and systemic inflammation, not weight gain, per clinical manifestations. 150. The T-spot TB test is less reliable in immunocompromised patients. True or false? Answer. False rationale. The T-spot TB test, an IGRA, is generally reliable, though sensitivity may be reduced in severely immunocompromised patients, per CDC Diagnostics. 151. Patients with active TB should avoid contact with immunocompromised individuals. True or false? Answer. True rationale. Immunocompromised individuals are at high risk for severe TB, necessitating avoidance of contact with active TB patients, per CDC guidelines. 152. A single dose of isoniazid is sufficient for latent TB treatment. True or false? Answer. False rationale. Latent TB treatment requires 6 to 9 months of isoniazid or alternative regimens, not a single dose, per CDC treatment guidelines. 153. TB can cause pleural effusion on chest X-ray. True or false? Answer. True rationale. Pleural effusion is a common radiologic finding in pulmonary or extrapulmonary TB, indicating pleural involvement, per radiologic findings. 154. The BCG vaccine is mandatory in all countries. True or false? Answer. False rationale. The BCG vaccine is used in high TB burden countries, but not mandatory globally, with varying policies, e.g., not used in the U.S., per WHO vaccination strategies. 155. The nurse should monitor for peripheral neuropathy in patients taking isoniazid. True or false? Answer. True. Rationale. Isoniazid can cause peripheral neuropathy due to vitamin B6 depletion, requiring pyridoxine supplementation and monitoring per pharmacological side effects. 156. TB is only transmitted indoors. True or false? Answer. False. Rationale. TB can be transmitted in any enclosed space, indoor or outdoor, where airborne droplets linger, per CDC transmission risk factors. 157. A GON complex on chest X-ray indicates healed TB infection. True or false? Answer. True. Rationale. A GON complex, GON focus with hilar lymphadenopathy, indicates healed primary TB infection, often calcified, per radiologic findings. 158. All TB patients require directly observed therapy, DOT. True or false? Answer. False. Rationale. DOT is recommended for high-risk TB patients, e.g., non-adherent MDR-TB, but not mandatory for all, per WHO treatment protocols. 159. TB can cause hemoptysis in advanced disease. True or false? Answer. True. Rationale. Hemoptysis occurs in advanced pulmonary TB due to lung cavitation and vascular damage, per clinical manifestations. 160. Patients with latent TB always progress to active disease. True or false? Answer. False. Rationale. Only 5 to 10% of latent TB cases progress to active disease, often triggered by immunosuppression, per CDC epidemiology. 161. The nurse should teach TB patients to report dark urine. True or false? Answer. True. Rationale. Dark urine may indicate hepatotoxicity from TB drugs like rifampin or isoniazid, requiring immediate reporting, per patient education guidelines. 162. TB can be diagnosed using a blood culture. True or false? Answer. False. Rationale. TB is rarely diagnosed via blood culture, as Mycobacterium tuberculosis is primarily detected in sputum or tissue, per CDC Diagnostics. 163. Contact tracing is unnecessary for latent TB cases. True or false? Answer. True. Rationale. Latent TB is not contagious, so contact tracing is not needed, unlike active TB, per WHO public health strategies. 164. The BCG vaccine increases the risk of active TB. True or false? Answer. False. Rationale. The BCG vaccine does not increase TB risk. It aims to reduce severe forms, though efficacy varies, per WHO vaccination data. 165. TB can cause erythema nodosum as a hypersensitivity reaction. True or false? Answer. True. Rationale. Erythema nodosum, painful skin nodules, can occur as a hypersensitivity reaction to TB infection, per clinical manifestations. 166. A positive sputum smear always indicates MDR-TB. True or false? Answer. False. Rationale. A positive sputum smear indicates TB, but does not specify drug resistance, requiring susceptibility testing, per WHO Diagnostics. 167. The nurse should assess for fever in suspected TB cases. True or false? Answer. True. Rationale. Fever, often low-grade, is a common symptom of active TB, requiring assessment, per clinical evaluation guidelines. 168. TB treatment can be safely stopped if sputum cultures are negative after 1 month. True or false? Answer. False. Rationale. TB treatment must continue for 6 to 9 months, even with early negative cultures, to prevent relapse, per WHO guidelines. 169. HIV testing is recommended for all TB patients. True or false? Answer. True. Rationale. HIV testing is recommended for TB patients due to the high risk of co-infection and its impact on treatment, per WHO co-infection guidelines. 170. The nurse should use gloves when handling TB patient specimens. True or false? Answer. True. Rationale. Gloves are part of standard precautions when handling potentially infectious TB specimens, per CDC infection control standards. 171. TB can cause meningitis in children. True or false? Answer. True. Rationale. TB meningitis is a severe extrapulmonary form, more common in children with high morbidity, per clinical manifestations. 172. The quantiferin TB gold test is performed on sputum samples. True or false? Answer. False rationale. The quantiferin TB gold test is a blood-based IGRA, not performed on sputum, per CDC diagnostic methods. 173. Patients with active TB should avoid strenuous exercise. True or false? Answer. True rationale. Strenuous exercise may exacerbate symptoms like dyspnea in active TB, requiring rest during early treatment, per patient education guidelines. 174. All TB cases are caused by Mycobacterium tuberculosis. True or false? Answer. False rationale. While most TB is caused by Mycobacterium tuberculosis, other species, e.g., Mycobacterium bovis, can cause TB-like disease, per CDC etiology. 175. The nurse should teach TB patients to report numbness in extremities. True or false? Answer. True rationale. Numbness may indicate peripheral neuropathy from isoniazid, requiring immediate reporting, per patient education guidelines. 176. TB can be transmitted through kissing. True or false? Answer. False rationale. TB is not typically transmitted through kissing, as it requires inhalation of airborne droplets, per CDC transmission routes. 177. A chest X-ray showing a tree and bud pattern is suggestive of TB. True or false? Answer. True rationale. The tree and bud pattern on chest X-ray indicates endobronchial TB spread, suggestive of active disease, per radiologic findings. 178. Latent TB treatment is ineffective in preventing active disease. True or false? Answer. False rationale. Latent TB treatment, e.g., isoniazid, significantly reduces the risk of progression to active disease, per CDC preventive therapy data. 179. TB can cause osteomyelitis in extrapulmonary disease. True or false? Answer. True rationale. TB osteomyelitis, affecting bones like the spine, Pott's disease, is a form of extrapulmonary TB, per clinical manifestations. 180. The BCG vaccine is a live attenuated vaccine. True or false? Answer. True rationale. The BCG vaccine contains live attenuated Mycobacterium bovis, used to stimulate immunity, per WHO vaccination data. 181. The nurse should monitor for rash in patients taking rifampin. True or false? Answer. True rationale. Rifampin can cause allergic rashes, requiring monitoring and reporting if severe, per pharmacological side effects. 182. TB is only contagious in immunocompromised patients. True or false? Answer. False rationale. TB is contagious in any patient with active pulmonary disease, regardless of immune status, per CDC transmission principles. 183. A 15 mm induration on a TST is positive in low-risk individuals. True or false? Answer. True rationale. A 15 mm induration is considered positive in low-risk individuals with no known TB exposure, per CDC TST interpretation criteria. 184. TB treatment can cause permanent vision loss. True or false? Answer. True rationale. Ethambutol can cause optic neuritis, potentially leading to permanent vision loss if not addressed, per pharmacological side effects. 185. Patients with active TB should have regular chest X-rays during treatment. True or false? Answer. True rationale. Periodic chest X-rays monitor treatment response and disease progression in active TB, per WHO monitoring guidelines. 186. The T-spot TB test is more accurate than sputum culture for TB diagnosis. True or false? Answer. False rationale. Sputum culture is the gold standard for TB diagnosis, while T-spot TB detects infection, not active disease, per CDC Diagnostics. 187. TB can cause a positive ANA test in autoimmune-like reactions. True or false? Answer. True rationale. TB can trigger autoimmune-like responses, occasionally causing a positive ANA test, per clinical manifestations. 188. All TB patients require hospitalization during the intensive phase. True or false? Answer. False rationale. Most TB patients can be treated outpatient during the intensive phase, unless severe or non-adherent, per WHO treatment protocols. 189. The nurse should teach TB patients to avoid grapefruit juice during treatment. True or false? Answer. True. Rationale. Grapefruit juice can interact with TB drugs like rifampin, affecting metabolism, per pharmacological interactions. 190. TB can cause a normal sputum culture in early disease. True or false? Answer. True. Rationale. Early active TB may yield negative sputum cultures due to low bacterial load, requiring molecular tests, per CDC Diagnostics. 191. Patients with MDR-TB should be isolated for the entire treatment duration. True or false? Answer. False. Rationale. MDR-TB patients require isolation until non-infectious, e.g., negative sputum, not for the entire 18-24-month treatment, per CDC infection control. 192. The BCG vaccine is safe for HIV-positive individuals. True or false? Answer. False. Rationale. The BCG vaccine, a live vaccine, is contraindicated in HIV-positive individuals due to risk of disseminated disease, per WHO guidelines. 193. TB can cause a productive cough as a primary symptom. True or false? Answer. True. Rationale. A productive cough is a common symptom of pulmonary TB, especially in advanced disease, per clinical manifestations. 194. A negative chest X-ray rules out extrapulmonary TB. True or false? Answer. False. Rationale. Extrapulmonary TB may not appear on chest X-ray, requiring other imaging or biopsies for diagnosis, per CDC Diagnostics. 195. The nurse should assess for lymphadenopathy in suspected TB cases. True or false? Answer. True. Rationale. Lymphadenopathy, especially cervical, is a common sign of extrapulmonary TB, requiring assessment, per clinical evaluation guidelines. 196. TB treatment is safe during pregnancy. True or false? Answer. True. Rationale. Standard TB drugs, e.g., isoniazid, rifampin, are generally safe in pregnancy, with benefits outweighing risks, per WHO treatment guidelines. 197. The GeneXpert MTB/REF test is used for latent TB diagnosis. True or false? Answer. False. Rationale. The GeneXpert MTB/REF test is used for active TB and resistance detection, not latent TB, which requires TST or IGRA, per WHO Diagnostics. 198. TB can cause anorexia as a systemic symptom. True or false? Answer. True. Rationale. Anorexia, loss of appetite, is a common systemic symptom of active TB due to chronic inflammation, per clinical manifestations. 199. The nurse should teach TB patients to report hearing loss while on streptomycin. True or false? Answer. True. Rationale. Streptomycin can cause ototoxicity, leading to hearing loss, requiring immediate reporting, per patient education guidelines. 200. TB is a vaccine-preventable disease in all cases. True or false? Answer. False. Rationale. TB is not fully vaccine-preventable, as the BCG vaccine has variable efficacy and does not prevent all cases, per WHO prevention strategies.